Hi everybody, this is Terrill White, and this is probably going to be my first video vlog, I guess is what they call it, regarding my health. As you may be able to tell from the video, I don't know, I'm driving to work, first of all, and so a lot of my postings and things like that will come while I'm driving to work. Don't fear, I won't be looking at the camera very much, and I drive on a road that's not very busy anyway, but I won't be looking at the camera very much. But I don't know if you can tell from the video that I'm a very large man. I weigh 357.4 pounds. I'm 6 foot tall, so that fat does not have very much area to stretch out across. So I'm quite large, quite plump, you might say. And my weight is something that I've struggled with my entire life. And I just have had problems with my weight. Very low self-esteem as a result of it. I've always had a problem approaching people, just even in friendships and things like that, because of my weight. I'm just very self-conscious about it, and I'm surprised I'm married, because I've just always had a problem with my weight. It's been something that has bothered me mentally my whole life, especially since I was about 11 years old. I wasn't really a big kid, like child, until I was 11. I started getting bigger, and anyway, I have decided that it's time for me to do something about my weight. I have, in the past, about 2.5 years ago, I went on a diet, whatever, and I was just counting calories and things like that, and I was also walking between 3 to 5 miles a day. Sometimes every other day I would try to squeeze in 6 miles if possible. And I lost 75 pounds. I went from 350 pounds to 275 pounds. And I was feeling great about myself. I've got something in my eye right now, and I apologize, I'm sitting here digging at my eye. But I lost 75 pounds, and I felt great about myself. And then one day, something happened. I don't even know what happened. It was just like one day, just somebody came and just turned the lights off. And I had no energy. I had no get up and go, And so I didn't know what was wrong. I became very depressed and things like that. And that actually continued for about 2 years, until a few months ago, I finally had enough. I've been having a lot of severe headaches and things, and so I am a Native American. I know it doesn't look like it, but I am. And so I go to our Indian health clinic usually when I have a health issue. And so I went to our Indian health clinic 3 or 4 times over these severe headaches that I was having. And all they would do was send me home with some ibuprofen and a muscle relaxer, because they said that I had some tension in my neck. To kind of go back and preface that a little bit, I had a wreck about 3 years ago on the very road that I'm driving on right now, and I was actually using my phone. I was talking to my wife on the phone, and I had a head-on collision with somebody. They were actually on my side of the road, and I had crossed over to their side of the road because the road was wet. I was actually watching the road, and they were too. I could see that they were watching the road, but I just had a wreck, and it was a very severe wreck. Completely totaled out my Dodge Ram, and it just completely devastated the whole vehicle. And so I sustained some head trauma as a result of that, and also I sustained some severe whiplash. And I kept going to the doctor, and I kept telling them, something's not right. There's something not right with my head. And they never would do anything about it. And so finally I'd had enough. And so about 2 months ago, I contacted my regular physician. And I say this because most people who are within the Native American population know when we say the white man doctor, that means the doctor that's not connected to the Indian Health Clinic. And yes, I'm a white man, but I'm also Native American. So I went to the white man doctor that I use my insurance for, and I actually haven't been to him in 7 years because I've been pretty satisfied with the health care I was getting at the Indian Health Clinic. And but I went to him, and he ordered some MRIs and things, and also some blood tests, because I told him I just didn't have any get up and go and all that. I'm sorry, I'm tired. So, but anyway, he ordered some blood tests and MRI because he didn't know what was going on. He didn't know if I had maybe a tumor, if I had some kind of lesion or something as a result of brain trauma or what. But anyway, he ran those tests, and he found out 3 things. And one of those things is that I was low on testosterone, which right there causes your depression, it causes your lack of energy, it causes weight gain, and things like that. And so he started me on testosterone therapy. Take 1 milliliter every other week, and it's an injection that I do at home. I've already noticed some change, some difference in that. He's going to test me a few weeks and see if they need to adjust my dosage as well. And then also they found out, which really isn't related to my weight, but that I have 3 ruptured discs in my neck, which are a result of the car accident I was in. That's causing extra pressure to be applied to my spinal column, which is causing my headaches. It's also causing some neuropathy in my arms. And also I have something called a Chiari-1 malformation, which is something that I could have been born with, or it's something that I could have been a result from a car accident. And that's when the tonsils of my cerebellum, I didn't even know your cerebellum had tonsils, but they're slipping down into the big hole at the base of my skull. And it's kind of a common thing, but it does cause migraines, and I've had severe migraines my whole life. I outgrew them though. We thought when I was about 18 I stopped having them. I'd have them occasionally, but that was the last time I had what we call a doozy of a migraine. And so that's something that they're sending me to a neurosurgeon. The neck and the head, the brain thing, I'll be going to a neurosurgeon in February, and they don't think I need surgery or anything, but they want to see what the neurosurgeon says. Maybe I need physical therapy for the neck, and then the Chiari-1 malformation is not even bad enough to even worry about, but they'll have to treat me with migraine medication probably for the rest of my life. But I trust the Lord that He can deliver me from that. But anyway, back to my weight. As I said, I believe I said I'd lost 75 pounds about 2 years ago, and I've gained every bit of it back and then some. And it actually didn't take me very long at all to gain all this weight back. And so I've been having some severe back problems. I've been having some knee problems, and my blood pressure is just all wanky and all that stuff. And so I decided it's time for me to do something about it. People have referred me to, gastric bypass and all that stuff. That stuff ain't for me. I've had a friend that died as a result of it. Everybody I know that's had it has been sick. I ain't gonna go through that. If you've had it and it was successful, good for you. But anyway, this week, Monday, today's Friday, Monday I actually started kind of a clean eating challenge for 21 days with a friend of mine from church. and there's several of us that are actually doing it. But I'm not eating any sugar this week for the next 3 weeks, and no bread and things like that. I weighed myself this morning, but I'm not going to tell how much I weighed. But I've already lost a considerable amount of weight for 1 week, and I'm eating all my calories that I need and everything, but it's just the food is not as unhealthy. Actually, the food is very healthy. I'm eating lots of chicken, lots of fish. I'm having some beans today with some fish. It's Fish Friday, even though I ain't Catholic. And so we're going to see where this path goes, and I will be updating this vlog as often as I can, at least once a week. I've had a rough few days, though I will tell you that anytime you change your diet, it's going to be rough. And so post your comments down below if you want. This is mainly for me, but if you find some encouragement through it, then great. And post encouraging comments, and like this video, share it if you want. Thanks a lot. Bye.